Hello, everyone. Can you guys hear us and see us? If you just thumbs up in the messages, that would be great, just so that I can make sure that you... okay, perfect. We will give everyone maybe a few more minutes to join, and then we'll start. We'll get started at maybe 6:35, so just 2 more minutes. Okay, I think we'll go ahead and start. The plan for the day is we'll start just by a little bit of an introduction about the research team and what kind of plans have we got. And then I'll introduce our speaker for today, Dr. Valirie Ndip. He will be giving a presentation on systematic reviews, and then hopefully we can have a bit kind of a discussion. If people have any questions, please feel free to post them in the chat. Temi, if that's all right, would you be able to keep an eye on the chat just to see if there are any questions for Valirie? Thank you. So my name is Noon. I'm the research lead for this year, and I'm working with Temi, and we've got a lot in plan for what we want to do in preparation for this application cycle. There are 2 things that we're focusing on. The first part is on research, which is part of what we're doing today. And the second part that we're trying to focus on is on quality improvements in audits, quality improvement projects in audits. We're aiming to focus on that first because in the application and for portfolio discount for a lot of marks, so that we want to help maximize or support people in maximizing their portfolio scores for the upcoming application round. But we also hope that the knowledge that people will gain will be beyond just the portfolio scores. In terms of the quality improvement projects and the audits, we have done one workshop in the past few weeks, and that focused on we've talked a little bit about what they are and what their definition, how to go about doing them, and we want to follow up on that with workshops. And what we want to do today is again talk about some research methodology that people can consider, and we would want to support people if they're interested in starting a project or working on a systematic review, a scoping review, any research project with the intention of presenting it or publishing it. Today, like I said, will be the first session for the research club, but Teme and I will be sending in the group in the next few days some research ideas that we're considering that people could take on. And if also people have any ideas, please feel free to kind of share in the group. Also, if you already have some ideas, feel free to ask Valirie at any point about what you're thinking and to get some tips while we've got them. And we'll also be sending kind of further details about follow-up workshops that we want to do. So like I said, we're trying to help people support people in maximizing their scores, and we will be sending further details about kind of support workshops that we're planning. So without kind of talking a bit more about this, I'll give the floor to our speaker today. We have here Dr. Valirie Ndip. He is a clinician from Cameroon. He is also very passionate about research. We were colleagues at some point, and he's one of the few people that I know who's extremely passionate about research, very well kind of knowledgeable. He's extremely accomplished in terms of kind of publications. Also, he has, in addition to his research, he also holds a number of kind of editorial roles. So not only has he had first-hand experience of research, he also has experience editing other people's research, advising in that sense. So I think he would have a wealth of experience that we can all learn from today. I'll hand over to you, Valirie, and thank you so much for accepting our invitation today.
Thanks so much. Thanks for inviting me, and it's always a pleasure to talk about research. And I'll just pull up my slides for just let me know if you can see which of my slides.
I can see your slides.
The main slide?
Yes.
Okay. Okay, so thanks once again. And today we'll be just having discussion. It will just be an introduction to systematic reviews, and so for you to appreciate why you need a systematic review, and if you get to that stage where you need to do a systematic review, for you to appreciate the different steps that are involved in conducting a systematic review, either for your own study or if you want to join a different research group, so that you can have the basic ideas and the concepts. And I'm mostly hoping that we will have a discussion around it. So if there's anything that's unclear and you want me to explain it further, please stop me at any point, and then I'm going to explain further. And Another thing I wanted to ask if people are familiar with systematic review, if you have done it before or if you have seen it before. Yeah, I can't see the charts, but I'm just going to start with the presentation anyway. So the main objectives, therefore, will be for us to understand the need for a systematic review, what is meant to do, and to learn how to formulate a question that can be answered using a systematic review. Then after we have decided on a question that we want to answer, we'll need to know the different steps that are involved in conducting a systematic review, and then understand how you present the results or the methods of your systematic reviews. So just to set it off, there are different reviews, there are different types of reviews. And so a review is just collecting a bunch of different studies that have been conducted on a specific area of research. And so there are a bunch of related studies that you are trying to combine all of that information into one to constitute the reviews. And broadly, you can classify reviews into three. They are what they call narrative reviews that we are going to talk about. There are scoping reviews, and then there are systematic reviews, which is going to be the main focus for this presentation. So in narrative reviews, usually there is no documented methods in which you go about identifying or selecting the individual studies that we have talked about. And this type of review is usually done by an expert or an authoritative body in an area of research. And it's usually quick to perform. Usually you have a central idea or you have a hypothesis, and then you go into the literature. You try to find individual studies that support your central idea to make a conclusion on a certain topic. But you can see that this can be problematic because it's usually subjective, and that your central idea might not be correct. And usually if you have an idea, even if it's wrong, you usually find studies in the literature that support your ideas. So this is not a gold standard because it's subjective. And usually the authors do not explain or give the step-by-step breakdown in which they went about identifying the different studies to come up with the conclusion that they are presenting with. So this is usually lower in terms of the strength or the level of evidence. So what we want to be doing is systematic reviews that use more rigorous, systematic and transparent approach to gather and appraise or synthesize evidence to answer a well-defined question. The methods that you use to select or interpret the findings is usually transparent and are therefore less prone to bias. Now, systematic reviews, the problem with them is that they are time consuming and they require a lot of resource, usually human resource. So for example, if you are starting a systematic review for your first time, it might take an average of 18 months just to complete a systematic review. But that time might considerably shorten if you are doing that systematic review with people who are already experienced in conducting one, and it can even be as short as 3 months or even 6 months. So hopefully you appreciate at this point the need for a multidisciplinary team. Usually you'll be working with, in an ideal scenario, you'll be working with librarians. You will see where librarians come into systematic review and why they're instrumental. You'll be working with maybe epidemiologists and statisticians, and then clinicians as well. So it's usually a multidisciplinary team, and it's advisable to form this team when you want to conduct a systematic review rather than doing it alone. So why do you want, therefore, to perform systematic review? The main reason is so you have an area of research. For example, there are many different findings on that particular area of research. There are studies that have shown, for example, that a particular drug will work for some disease, and other studies are showing that it doesn't work. And so there's that controversy. So you want to summarize all of that evidence to come up with a conclusion, with a systematic and logical conclusion. Maybe there's already evidence that a particular drug doesn't work, and there are new studies coming up showing that the intervention works, and you want to update that previous evidence and try to discuss why there's this discrepancy in the evidence. So those are some of the scenarios where you need to do a systematic review. So at times you might be applying for a grant, and you need to conduct a systematic review around the research question that you're applying for that grant to be able to support your grant application. So this is one area. And finally, you might be doing a systematic review, and we see this for many different societies, like, for example, the European Society of Cardiology. They conduct reviews in order to inform clinical guidelines. So we switch gears a little bit and talk about, so we have talked about narrative reviews, where it's usually subjective and there is usually no documentation in which you go about identifying the different studies that you include in the review. We have talked about systematic review. Then for scoping reviews, they are a little bit similar to systematic reviews. But there are some subtle differences that we are going to talk about. And in scoping reviews, the aim is just to identify the nature and the extent of research evidence on a particular, on a specific topic. We'll talk about that a little bit more. Simply put, we just want to know, in this case, we just want to know what is out there. This is a little bit different from a systematic review where you have a very precise question that you are trying to answer. And so scoping reviews therefore also involve a systematic approach. So you have to document how you went about identifying the different studies that you're including in your review. But there's less rigor about the quality of the studies that you are including in that review. And that is the key difference between scoping reviews and systematic reviews. So the first difference is in how you frame the question for the review between scoping and systematic review, and the rigor in the quality of the studies that you are including in your review. So we go back again to the question of, when do you therefore use a systematic review or a scoping review? So this is a first example. This is a systematic review. And the main aim here is I want you to appreciate how precise the question for the systematic review is compared to the research question for the scoping review that we are going to talk about. So for example, in this case, the authors want to investigate whether clopidogrel and aspirin, or double antiplatelet therapy, has added benefits above and beyond aspirin alone in preventing recurrent thrombotic events in patients with a minor stroke or high risk of transient ischemic attack. So you appreciate, you see how precise a question is. And this is the type of questions that you want to formulate to for systematic reviews. And we're going to go into the systematic reviews questions a little bit more to try to break it down so that you see the different components of the question. So if we look at this case, this one was a scoping review that we did a few years ago. You see that the question for the scoping review is a little bit is broader compared to the systematic review. So in this case, the authors just wanted to summarize available data on the prevalence, associated factors, etiologies, comorbidities, treatments, and all of that. So you see that it's broader than the question for the systematic review. So it's less precise. So we just wanted to know what is out there concerning chronic kidney disease and summarize that evidence. So in scoping review, you just want to know what is out there. The question is a little bit more open and broad, and you want to summarize the evidence. Then for systematic review, you have a precise question about a particular topic, and you want to now gather the evidence and answer that precise question. So in this case, the difference between the two reviews is how precise your question is. So let's move on to how, at this stage, if you have any question, please feel free to ask, and we'll discuss a little bit further about it before I continue. So let's look at how you can conduct your own systematic review. And the first thing that most people overlook, even some people who are already familiar with conducting systematic reviews, is to know if what you are trying to do has already been done. And so you find people who have gone through all the different stages. They have written a protocol, because ideally you want to write a protocol before doing the systematic review. They have already written a full-blown protocol for a systematic review. They invite me, for example, for authorship, and then you do some searches and you find that what they are trying to do has already been done. And so all of that effort is wasted. So if you have a research question and you want to do a systematic review, we have talked about how intense and how long it takes to complete one systematic review. So you need to know if what you are trying to do has already been done. So you want to search different databases. So if you are looking at, for example, interventional studies or clinical trials or things that are trying to see if one intervention or a drug or a device works for a particular condition, you can look at the Cochrane database for systematic reviews. Is mostly for interventional studies. The Prospero database is where you register your systematic review. So it's worth looking at the Prospero database, because the authors might be working already on your idea, even though it's not published. So you might want to see if they had already registered that a review on what you are trying to work on. So it's definitely worth looking at the Prospero database. And the other things you can look at, you can look at PubMed, which is a database that contains publication, health-related publications, and our simple friend Google might also give you the answer. Now, another question is, so what if you find out that what you are trying to work on has already, so there are some authors working on it already, or they have published on it? So one thing you could do is you could say, okay, when was that review published? Was it published, for example, 10 years ago? Is it possible that the evidence has changed over time? And is there therefore a need to update the available evidence? is one thing you could consider. So even if it has been done before, it's possible to update the available evidence. Another thing is to see, okay, can you adapt your question to answer some additional aspects of that topic that the current review did not address, is one thing one could consider. Or those are some of the things. If you find out that what you are trying to work on has already been done, you can always find a niche if it's something that you are really interested in, and add additional information on that topic. So after you are certain that what you are trying to do has not been done before, you need to go on to formulate the search. But before you go on to formulate the search, you need to refine your question in such a way that it can be answered using a systematic review. Now, the systematic review question is very important because it is going to guide how you formulate your search strategy. So we'll talk about what the search strategy is. It's going to define how the eligibility of studies that you are going to include in your study. So it's very important that you get the question right from the get-go before you even start your search. So what is the systematic search? Therefore aims to identify it aims to identify all relevant studies that have been published in a particular area. So the key goal of a systematic review is you have a question that you are trying to answer, and you want to identify in an ideal scenario, every possible study that is eligible and has been published on that topic. You want to identify all of those studies and then summarize the evidence and come up with a conclusion. You see, so, and the way you do that, you need to formulate a clear question that we have talked about, develop a protocol. Now, once you develop a protocol, you need to decide the sources in which you want to search for these individual studies. We'll talk about different databases that you could use to search for studies that you include in your systematic review. So once you have decided on the sources, you go on to develop the search strategy, and then you save your search results. So let's talk a little bit about how you formulate the question. So there is this framework that is called the PICOT. So it's the PICOT framework for systematic review, and it guides you on the different components that are supposed to be included in your systematic review question. So the PICOT, so P is for the population or the participants that you are concerned with. So for example, are they adults? Are they women of reproductive age? Are they children, for example? Or maybe a group of patients that have had a specific intervention, or a group of patients with a specific condition, say diabetes, for example. It could be I or E depending on the type of study that you're interested in. So for example, if you're interested in systematic randomized controlled trials, for example, you'll be looking at mostly interventions. But if you are interested in observational studies, so an observational study will be, is diabetes, for example, a risk factor for myocardial infarction, and you want to just look at risk factors, this will be observational studies. And instead of you are going to have exposure, and in this case, exposure is going to be diabetes. So you need a comparator group, not always, but you need a comparator group if you are looking at intervention studies, or a control group. So in the case of is diabetes a risk factor for your myocardial infarction, you'll be comparing the exposure, which is those with diabetes, to the controls who are those without diabetes. So you need a comparator group. The next thing that your question is supposed to contain is the outcome. What will be the outcome? We'll look at this in further detail. These two they're optional. They look at the time. So, for example, are you interested in including studies after 2010 for some particular reason? So, if you want to look at studies on COVID-19, for example, it's needless to start looking at studies that were published in, say, 2008, except you have some specific reason to look at COVID-19, which didn't even exist at the time, really. And then the last is the study design. So what type of study designs will you be including in your study? So if you are concerned with interventions and say, for example, there's a particular drug prevent some disease, you want to be including randomized controlled trials ideally. Or if you are concerned with observational studies, you need to decide if you're including cross-sectional studies, case control studies, or prospective cohort studies, depending on what will be the best type of study to answer the question that you're posing. So if we look at an example of a systematic review question guided by that, the PICOT framework that we were talking about. So one question will be, are adults with rheumatic arthritis more likely to have a heart attack if they are taking celecoxib than diclofenac? So the participants or the population in this question will be adults with rheumatoid arthritis, right? The intervention. So in this case, we are looking at an intervention and at an intervention study. So it makes sense to follow the PICOT. The intervention here will be celecoxib, which we are interested in. We are comparing celecoxib to diclofenac. The outcome will be, are they more likely to have a heart attack? So the heart attack will be the simpler term, but in this case, we want to be more clinical and say myocardial infarction. The time will be a little bit relative. So, for example, you can say if they take it for at least 4 weeks, so you want to include lay participants who took it for at least 4 weeks. Now, it depends on the question that you're trying to answer. So maybe, for example, if they took it for less than a week, it has not been shown to have any detrimental effect compared to diclofenac, and you want to look at a longer period of exposure. And then, of course, since it's an intervention study, the gold standard to answer this question will be to include randomized controlled trials. Now, one thing about systematic reviews and the question is, based on my experience, is you want to, especially if you are starting off, you want to keep the question as simple as possible, but it should be relevant. You don't want to overload your back. At most of the times we are enthusiastic about what we want to do and want to answer a lot of things. But if your question is just too broad, that review might end up in the bin. You might end up not finishing the review. So you want to keep your question as simple as possible, although relevant. Then answer it reliably. Like if you see the donkey in the background, don't bite more than what you can chew. So once you are clear with the question and you see that it fits into the PICOT framework that we have looked at, you can go ahead and develop your protocol So one good thing about systematic reviews is that you are encouraged, although some people don't do it, but you are encouraged to develop a protocol on how you are going to conduct the review and present your findings and publish that protocol before. So publish it in a peer-reviewed journal, or you can publish it on the Prospero website that we talked about before starting a review, so that in case you have, this minimizes bias when you start looking at the data. So in case you have any deviation from your main publication, if your main publication deviates from the protocol itself, then you need to do some explaining. So it's important to publish a protocol beforehand. So the key elements of the protocol will be to provide some summary of the relevant background of what the question you're trying to answer. You state the review question clearly, and then you want to be clear about the eligibility criteria. So in the case of a review, it's different from individual studies where we recruit participants to take part in our study. In the case of a review, the unit of analysis are those individual studies, not individual participants. So you need to be talking about the inclusion and the exclusion criteria of different studies, not the participants themselves, if that makes sense. Now there's a guide or a checklist called the Prisma P for protocols. So this checklist can help you, it can guide you to write your protocol if you ever need to write one. And this is the link to the updated guidelines. And you can always use the Prospero website to publish your protocol before starting the review. And it's always a good idea to do the protocol because it forces you to think carefully about the question, carefully about the studies that you want to include in that review, and the data that you need to answer the question, and how you're going to extract the data. So we are going to talk about data extraction shortly. So we have talked about developing the protocol, developing the review question. You need to, after you develop the review question, before designing the search strategy. So the search strategy, before designing the search strategy, you need to decide which databases you are going to use to look for studies that you are going to include in the systematic review. So there are many different databases that you can look at, but the most common ones are these ones for health-related studies. They are Medline or PubMed. You have Embase. You have the Cochrane Library, usually if you are doing an intervention study, or Web of Science. But most people use Medline or PubMed and Embase. But obviously, the more the database you search, the more likely you are to capture all of the individual studies. But again, the more database that you include, the more studies you have to screen before identifying the studies that are relevant for your review. So you need to strike the balance between the number of databases that you want to search, because the more database you search, the more difficult it will be to handle the different studies for your review. Again, other sources that you could look at if you are interested in intervention study is to ask pharmaceutical companies. You could look at clinicaltrial.gov. Usually it contains studies on intervention studies like randomized controlled trials need to be registered on clinicaltrial.gov, so you could go there and look at studies that are in the pipeline. It's important to know the different sources in which you can identify what we call gray literature. These are mostly things that are not published in the conventional website, or they are not published at all. So it could be a thesis that is lying in a library, for example. And then one other thing is to do what is called hand searching. So, for example, you can just, if you identify a particular study that's eligible, you might just want to glance through or screen carefully the reference section of that paper, because it might have cited some other studies that are relevant for your review. So once we have decided on, so with all of these things, usually, like I said, the main database is a PubMed, Embase, maybe Web of Science, and Cochrane Library. So once you have developed a search strategy, once you have identified the different databases to search, the next thing will be to develop now the search strategy. So the search strategy, you can think of it as a computer code that you are passing to a database to give you the studies that you need for your particular review. Now, if that code is wrong, you are going to get the wrong studies, or you are going to miss some studies. So it's very important that that search strategy is carefully designed, because the studies that you get from that search is going to determine the quality of your review. So that's why librarians are experts in designing search strategies. You must not work with a librarian, but if you can get access to one, it will be great. You can also learn how to design different search strategies. So people who have been working on systematic review and have taken courses on how to design search strategy, we usually know how to do this. But at times it can also be as simple, it can be a simple search, but I will not go into the details of designing the search strategy. But just to know that the search strategy is very important, and how you define the different search terms for your review is also important, and is going to determine the quality of that review. So let's look at how to define the design the search strategy. So if we go back to that research question that we looked at earlier about celecoxib and diclofenac amongst adults with rheumatoid arthritis. So the aim here is to say, okay, I want to design a search that's going to capture studies that has keywords that include rheumatoid arthritis, diclofenac, myocardial infarction, and maybe studies that only randomized control trials. So I don't want to maybe include studies that are cross-sectional studies or prospective cohort studies. But usually it's advisable to leave, except you are experienced in the search strategy, just keep the study design open. So we will start with the population. Usually a key term will include terms like, it can just include rheumatoid arthritis as one term, so in a block, and you use that for your search. Or you can use individual terms, so rheumatoid simply, you separate it, arthritis simply. For celecoxib, you could use the aim to identify celecoxib. For example, you might want to use different synonyms, or you want to use different forms of the drug to be able to identify it. So you can use celecoxib or celebrex or celebra, for example. So again, you go the same idea for diclofenac. You want to look at synonyms. You go to myocardial infarction. Some studies might report heart attack, for example, instead of myocardial infarction. You might want to capture that. So in the end, it's just to look at the different synonyms and the different search terms that other studies might use. Ideally, we want all studies to report myocardial infarction as myocardial infarction, but this is not usually the case. And that variation in which different authors report the different terms, the different key terms in your systematic review question, you want to capture that variation in your search strategy. So I'm going to leave these other two because it's just advisable to keep them open. And when you get the different studies, then you can exclude them based on whether the duration of the intervention was less than or more than 4 weeks, or whether the studies included in there were observational or intervention studies. So we have looked at how to define the question, how to select the different possible databases that you can select, and how to define your search strategy. One thing that I didn't mention is depending on the database that so just like how the codes for Windows, for example, might differ from Linux, for example, the way you define the search strategy for one database is going to differ with another database. So that's why it's important for you to decide which database you are going to use before defining your search strategy. So once you have selected the database, you have designed your search strategy, then you need to go on to, so you design your search strategy, you go ahead and then you search those databases. Once you search the database, if I can just do a short demo for you guys. So if I'll just open PubMed, for example. So this is one of the databases that we looked at, and this is PubMed, and we can say, let's say we want to answer the question, is diabetes a risk factor for myocardial infarction? And so in that search term, we are going to include diabetes. Another component of the search term will be myocardial infarction. So another form of diabetes will be, it could be hyperglycemia. Maybe the authors include hyperglycemia for some reason. We are going to include that and combine with something that they call OR. So this is a Boolean, what they call Boolean operators, where you are combining different terms, so you're combining synonyms. So I want studies that include the term diabetes or hyperglycemia to represent diabetes, or I don't know. Let's keep it simple. The next thing will be myocardial infarction, which is the outcome that we are looking at. So I want something that doesn't just include diabetes or myocardial infarction. I want a study that's talking about diabetes and myocardial infarction, because it's a little bit like set theorem. You don't want to include If you include diabetes and, it's just going to give you studies that are talking about diabetes and hyperglycemia. But if you include and myocardial infarction, but if you include diabetes or myocardial infarction, is going to give you any study that's talking about diabetes or myocardial infarction, including studies that are not talking about both of them, which is not what you need. So I want to search this as a single term. So if you want to search this as a single term, you need to embrace it in quotes, and you add them with "and." And to keep it simple, we can just do something like this, and then we run the search. And then you will see that in this database is from 1948 to 2004, is giving us 29,932 results. Now, these studies, you will need to, so after we run, we have searched PubMed. It has given us the study. The next stage now in this is to take all of these 29,000 records and then go ahead and start do what they call study screening, which is what I'm going to talking about next. So first stage is to search the database. It's not going to give you exactly the studies that you are going to need. It's going to give you a bunch of study. You need to go through now that bunch of studies to find the exact studies that you need to include in your review. So as an example, for example, this first study is a review. We want to include individual studies. We don't want to include reviews. So a study like this will not be eligible and we will need to be excluding them. So the next stage, therefore, after we have done that part, we have searched the database, it has given us those individual studies. The next thing is to do study screening and selection. So this process is, as you have seen, for example, in that simple case, we had 29,000 studies. It is very easy if you are doing the screening alone to make a mistake or to miss an eligible studies. So to add more reliability to that screening process. So the screening process is where you go through all of those records that we have identified from the database to try to find the studies that are eligible for your review. So that process should be done independently by two people to increase the reliability of that process. So the first stage is to do what is called title and abstract screening. So it would be practically impossible to read all of the 29,000 studies at a go to try to identify the studies for your review. It's not possible. So the first thing is to scan the title, scan the abstract. Does it talk about diabetes, and does it talk about diabetes and myocardial infarction, and whether diabetes is a risk factor? So you scan it. If at the go it seems like it's talking about that, you keep it for the next step, that is the full text screening, which we'll talk about. But if it's obviously not talking about it, you exclude it. If it's a review, we are not including review, you exclude it. If it's a case report, we are not including. So that's where you need to go back to what is eligible for my review, what type of study. Then you need to start excluding them at that stage. Now, after you do the title and the abstract screening, now there are some studies that when you did the title and abstract screening, they seem like they might be eligible for your review, but you need to go in detail. You need to read the full text. You need to read the methods and see if it's actually eligible for your review. So that the next stage, therefore, will be what we call full text screening, where you read now the studies carefully to see whether they are eligible for your review. Now, when two people are doing the screening, it is possible that one person might say, okay, let's include this study is eligible. The other person says it's not eligible. it happens very frequently. Now, the best thing would be for the two of them to look at the study again, discuss about it, and see if there's any change in ideas, and if both of them can agree to say, okay, I see your point, let's include the study, or okay, the study is not eligible, let's exclude it. But if they cannot come to a consensus, then you need to sort what we call an adjudicator. So an adjudicator is just a third author. That third author is going to look at those studies that you have conflicts over, and the person is going to give his own verdict and say, okay, maybe the study is eligible. If the person says the study is eligible, you include it. If the person says otherwise, then you exclude the study. So after you go through that screening process, you go through the title and abstract screening, the full text screening, you will be left now with studies that you are certain that are eligible for their review. But then you are ready to move on to the next stage, which is data extraction. But before we go to data extraction, I want us to talk a little bit about the importance of identifying all possible studies in that field of research, and why it's important not to look at only studies that have been published, to try to identify unpublished studies as well. So there are two key concepts here to understand. The first one is, so there are two key concepts. The first one is publication bias. So it's a concept whereby studies that have negative results, so studies that, for example, did not show any association, are less likely to be published. So the authors will not even bother publishing it, or some journals will reject publishing it. So if you report only positive studies, it's likely that those positive studies are biased. So it's very important to include all possible studies. Then another thing is selective outcome reporting, whereby the authors look at only studies that are important or that show an interesting result, and publish that. So it's important to identify all published studies in order to address these different forms of bias. And we have already talked about the different sources of unpublished data. So after you do the screening, you need to document the different stages of the screening. So for example, we looked at, so after we run the database searches, we identify this number of studies, you need to report that. We didn't talk about removal of duplicates, but if you search more than one database, it's likely that more than one study will be found in multiple databases, and you need to exclude those to prevent duplication of effort. Then you need to report on the full text, and for the full text stage, therefore, you need to explain or give a reason why you exclude some particular studies and quantify those. And then you end with the number of studies that were included in your review. Then we go to the data extraction stage. So after you have done that, in your protocol, it's important to outline the tables and figures that are going to appear in your results. And so this is going to guide the data that should be extracted for your review. And then you make some effort at least to identify the relevant data, because the data that you are looking for that review might not have been reported in the study, although the study is eligible. So it's important to contact the authors recurrently or severally to try to get the data for that review. So there are different sources. The most common source that we have seen is journal articles, where you can get data for your review. Another source is conference abstracts, but the problem with abstract is the authors usually do not report details about the methods. So some systematic review authors do not really feel comfortable including conference abstracts in their review, and most of the times you might see that by the time the study goes through peer review stage and eventually gets published, the findings might be different from what they presented in the abstract. So what should we extract therefore? So usually we want to extract mostly what we need because there's a lot of data out there, but you want to extract what is relevant for your review. So for example, things like the study design, eligibility criteria, or the method of sampling, the participants, their age. So since we are not looking at individual participants, we are looking at studies, we want to extract data on the mean age rather than the individual participant's age, or the percentage of females, for example, or the percentage of participants with some comorbidities. So the type of intervention, if you are looking at intervention study, or the exposure, so it could be, okay, how was diabetes, for example, assessed? What was the duration of exposure, the duration of diabetes, if that's relevant for your question, and the outcome, how the outcome was assessed, the timing of measurement, and some miscellaneous information. So it's important to extract only what you need, because the more information you need to extract, if you have 1,000 studies or maybe 200 studies to extract data from, if you have more information, the review is just going to take unnecessarily longer time to complete. So we have talked about approaching authors. If you find an eligible studies but the authors did not report the data in the format that you want, so you can send some emails to them and then try to ask, explaining what you are trying to do, your project, and ask if they can provide you data. It will be helpful to ask them precisely the type of data that you need. You can also ask them the full data set so that you analyze it, but usually authors are hesitant to give their data sets, so you might just ask them exactly what you need. If they can analyze that and give you, that would be great. So the final step is, so after we have selected the study to include in the review, the next thing will be to assess the quality of the studies that you are including in the review, and this is what we call risks of bias assessment. So you want to grade the different studies based on their quality and then draw a conclusion. You can say, for example, okay, does the conclusion change if I exclude low quality studies? So after you have included those studies, you need to do a risk of bias assessment, and this is one way in which a systematic review differ from scoping reviews. And there are different types of risks of bias tools. There's a link down here if you're interested in this type of things. So the next stage, therefore, is you have done all of these things. You have extracted your data. You have assessed the quality of the studies. The next stage will be to report your findings. So you need to report details about your search strategy for the different databases that you search. You need to report the Prisma flowchart. So the Prisma flowchart is the flowchart that shows how you included the different stages that you took to include studies in your review. Then the characteristics of the individual studies included in the review, and the quality assessment, which is all the risks of bias assessment. And then you summarize the key results for that review. Now, I just wanted to mention, if there's another instance where you might need to do statistical analysis of the results in case you did not come up with a clear conclusion. And that statistical analysis of results from a systematic review is what we call meta-analysis, which I'm not going to go into much detail. But I want to end by saying that the quality of your systematic review depends on the quality of individual studies that you include in that review. So therefore, if you include garbage study or poor quality studies, you are going to get poor results. So it's the term that they call garbage in and garbage out. So that will be the end of the presentation, and I'm happy to take any questions if you have.
Thank you so much, Valerie, for this very thorough presentation, as always. I'm very happy you included garbage in, garbage out. It's one of my favorite things about research, and it's also my husband's favorite thing to say about meta-analysis. So I'm glad you included that. I've got a couple of questions, and Tammy, if you don't mind, if you can keep an eye on the chat if anybody has any questions. When I introduced Valerie earlier, I mentioned that he's quite an accomplished researcher. He's been publishing for the better half of a decade. He's got over 70 different publications. And I wanted to ask you just to kind of open up a little bit about your research journey, because now so Valerie has just submitted his PhD thesis at the University of Oxford. And then just looking back at your journey so far, can you tell us kind of the things? How did you get started with research? Did you have to work on your own? Can you tell us a little bit about maybe working within a team? And especially because, for example, a PhD is quite a solo effort, but you can also work with a team when you're working on things like systematic review. So I just wanted to kind of get your personal take and research. How was it when you started out? How is it now? And what is it like working with a team when you're leading a project, but also when you're contributing to a project?
Yeah, okay, thank you so much. So I think it's really important to work in a team. So when I started, the first exposure that I had with research is at the end of a medical training. We are supposed to do a dissertation or a thesis, and so that was the first ever experience I had with research. But it was not all that fun when I submitted it. But I met a friend when I started working. He was publishing some research papers, and when I read his first publication, I was like, I'm interested in doing research. It wasn't fun because he was like, okay, he gave me. I started with a case report, so he was the one who guided me on the entire publication process, how you even go about writing the case report, how you submit it for publication. So I learned everything through him. So that's one the need for mentorship in terms of research. And that's how I got started. So when I published the first one, I just fell in love with it. It was just fun. And then I continued. It wasn't the easiest thing to do because I didn't really know anything concerning research, but I wanted to learn more. I guess that was the main thing. I wanted to learn more. So I went on Coursera, for example. He had a cross-sectional study that he was doing, I'll go and read about cross-sectional studies. What is it all about? What are odds ratios? What are hazard ratios? And all of those things. And then that's how I started growing. And I started identifying. So when we started publishing, I started identifying some other researchers, local researchers who were doing some things I was interested in. And then I got in contact with them, and they included me in some of the projects that we were doing. One of those projects was a systematic review to summarize the available evidence on heart failure in sub-Saharan Africa. And that was my first ever review. And that review sets the path for my admission into Oxford and getting a place for the PhD, because that's what even took me to Oxford, because I saw that they were doing something related to that. So in the end, mentorship is key, but you need to really want to do this. You need to, research is not the easiest thing if you are starting. So you need that resilience, but you also need that mentorship. Mentorship makes it easier.
Thank you for that. So I guess what I'm also curious about, one of the examples that you've shared with us was a scoping review. For someone who is starting to do research or does not necessarily have a lot of experience doing research, as some of the members in our group, what kind of tips would you give them in terms of starting early? I know you've talked about mentorship, which I cannot second more. I completely think that's especially when you're starting with research, you really need someone to kind of show you the ropes. What other things, looking back, you think would be helpful for you to know going into a systematic review or like a scoping review?
Right. So I'll just give the part I took. The main thing about learning all of these things is, it's good to learn about it when you are in the process of doing it. You learn more. You learn better that way, because I learned about system. I've taken, there's a course on Coursera on Introduction to Systematic Reviews, which I'd taken before. That course was helpful, but I forgot practically everything within a few months. But once I got to start doing the review in itself, yeah, I needed to go back and say, okay, we are talking about the question. What was the element of the question? Like what we are doing here. Um, what about the systematic search and all of that? So you need to do, um, yeah, you need to be in the process of doing it. It's more helpful that way. Yeah. So if you are someone who is starting, I want to do a scoping review. The good thing about most of these things, if you do the first one, if everything is easier from there, and some of these skills are transferable. So if you succeed to do a systematic review, either guided by someone else for the first time, the second one will be easier. So for this scoping review, for example, systematic reviews we had been doing systematic reviews, and then wanted to do something on pericarditis in Africa, but we were not really sure about what was out there. And then I proposed to one of my collaborators that I'd seen something called a scoping review out there, and they had published about the methods on how to conduct a scoping review. So when I read through the methods, I saw that it was practically similar to a systematic review, just that you are not doing the risk of bias assessment. So yeah, most of those skills are transferable, and there's a lot of help out there. If you do the first one, it will be easier to do subsequent ones as well.
And can you tell us a bit about your experience about working in research within a team? What kind of challenges come up, and how can people deal with it, especially if they're starting to work on a project together? What kind of things should people keep in mind?
Okay, let me talk about systematic review, since that's what we are talking about. So you need to work in a team. I guess we have already established that for systematic reviews. But the major issue, especially since if you're working with clinicians, which is likely what you are going to be doing, is that people do not simply have the time some don't have the patience to go through those 29,000 studies and screen them. So that's one thing. You need to consider the time. And so if you have 29,000 studies, for example, one approach in which we have succeeded in doing is to split that into chunks of maybe 2,000. And instead of getting 2 people to go through all of that, we can give it to 10 people, and a pair does the screening, and then we combine all of that. So you need to get more hands on deck to be able to complete it. So it's that time, it's that patience. You need people who are passionate about that. Maybe people who need also to publish, because people need to publish for various reasons. And so you need people who are passionate and are able to get that done. So that's one challenge as well. You need to work with someone who is experienced. Experience is key, because it's important to see the end of the review when you are starting it. If you see the end of the review, you can track back from there and anticipate some of the challenges that you're going to have along the way. But if you have never done it before, or you have not done enough reviews, it will be difficult to see those challenges and try to mitigate them from the get-go. And so, yeah, you need to work with some people who are experienced as well. So to get into some journals, I've not really experienced this before, but if you are thinking about publishing in high-impact journals, you might need to collaborate with people, with experts in your field, usually who are clinician and have already published in that journal and kind of have a voice, and you might want to include them as well in your review. So those are some of the things to consider.
Thank you so much for your answers. I have one more question, but I'll just see if anybody has any question. Please feel free to kind of jump in or send a message in the chat. Just to kind of make a comment on what Valerie's been saying. This year, as part of the research team, we're trying to again help create that kind of community where people can come, team up and work on projects. And Temi and I will be sending further details in the next few days to weeks about what we're planning to do, so that it's a bit more concrete. We have some ideas for research projects, but we would also welcome if people have an area of interest that they would like to work on, and if they have any ideas that they can bring forward, and what Valerie has talked about today about formalizing a research question, that could be an exercise we could do. So if you have any idea that's not necessarily formulated, please feel free to bring that, and then we can work together to formulate that into more of a research question. What my last question really, and I'll just keep checking if we get any more question from our attendees. So part of what you do is you wear multiple hats, Valerie, but one of the things you do is you are an editor in some journals, so you do review a number of research and kind of have a say on what gets published and what doesn't really get published. For people who are trying to do research with the intention of having that published, what do you look for when you're reviewing a paper to make the decision of, is this useful, is this novel? What kind of things do you look for? And one of the things that I'm hoping is you could also answer is, because people have this idea that for something to be published, it has to be like groundbreaking, and if you could just shed a bit more light on that.
Yeah, okay. So I guess it depends on in terms of novelty, it depends on the journal and their priorities. There are some journals that is just too difficult to get into, and you need something groundbreaking to get into, like the Lancet, for example. There are other journals that do not really focus a lot on novelty, and novelty doesn't really need to be something that's groundbreaking. So it could be something that's been done before in Western countries, and you are doing it in some other country, some non-Western country as well. So that is novel because you are doing it on another population, and that strengthens the evidence that's available out there. One thing that I look at is the research question clear? Because if you look at poor quality papers, it starts from the way the question has been asked. And if the research question is not clear, I already start having some doubts about the paper, and it's going to show down the line because it's going to determine on a lot of different things: how the search was done, how the studies were included in the review, if it's an analytic study, how the data was analyzed, and how they draw their conclusion in the end to support the question that was even not asked well in the first place. So I look at the question and make sure that the question is clear. Then go on to the methods to make sure that it has been well done. If it's a systematic review, how many databases were searched? How is the search strategy correct? So looking at the methods and the way the data was analyzed, then I'll go on to the way the authors discuss their results and then conclude based on that. So most of the times it's common for authors to be too passionate about their findings and over extrapolate it beyond what the data cannot support. So some of those things will lead to rejection because you are claiming what your data is not even supporting in the first place. So those are some of the things. But one other issue as well is the writing, if it's clear enough or not. At times there are some writings that can be managed and that the editorial team can help to improve the grammar for clarity, but some writings are not just clear, that it would take a lot of iterations to try to get it up to standard. It's just easier to exclude some of those papers as well. So that these are some of the things.
Thank you so much, Valerie. These are all my questions. I'm just going to have a quick look. Okay. I think that kind of covers all our questions. Really, thank you so much for coming today, talking to us and sharing quite a lot of your experience. If you have any kind of closing remarks, please go ahead. Or anything. Oh, let me just have a quick look. Yeah. Thank you so much. We will send some feedback forms to the attendees, and I'll share that with you in due time. But thank you so much, and thank you for everybody who's attended today. And please keep a lookout in the group when we share further details about what we have planned next. Thank you so much.
Yeah, thank you so much for having me. I'll just say if you have an idea for a systematic review, definitely go for it. It might help you just with the publication, but it might also be what is going to take you to that next level. You don't know who is reading, but somebody might just read their paper and that might be the breakthrough for you. So definitely go for it.
Thank you. Thank you so much. Enjoy your evening, everyone. Bye-bye.